The fluorescent lights hummed overhead, that particular hum that existed in every ICU in America, a frequency that somehow managed to be both background noise and the only thing you could hear at 3 in the morning. Sarah Chen folded her patient's hospital gown with the same precision she once used to pack field surgical kits in Bagram, her hand steady and mechanical, the creases sharp enough to cut. The fabric was still warm from the dryer in the basement laundry 3 floors below, and she worked in the supply closet of Seattle General's ICU in Philadelphia, where the smell of stale coffee mixed with antiseptic and something underneath it all, copper and decay that nobody talked about but everyone smelled. She didn't think about the gown. She thought about the patient in room for 47, the mute retired Marine whose chart she'd been monitoring for 6 hours, the one whose vital signs looked stable on paper but whose body was telling her something different. His name was listed as James Mercer, age 58, admitted 4 days ago post-surgery. He had scars on his hands that matched hers, old ones, white and precise, the kind that came from field dressing, not accidents. She'd caught sight of them during the 11 p.m. medication rounds, and her chest had tightened in a way she'd trained herself not to acknowledge. The cold stainless steel of the medication cart gleamed under the harsh white light as she moved through room 447's vital signs check at 2:16 a.m. Heart rate elevated at 112. Blood pressure climbing, 143/89. Oxygen saturation dropping incrementally, down to 94%. The ventilator wheezed its mechanical rhythm, steady and indifferent. Nothing acutely wrong. Nothing that would trigger an alarm. But Sarah had seen this pattern before, in Bagram, in the triage tent when soldiers came back from the Sanjin Valley with shrapnel wounds and psychological injuries that nobody could suture. The tremor in his jaw. The way his pupils constricted and dilated without pattern. The agitation that showed only in the way his fingers flexed against the restraints they'd had to use after he'd pulled his central line twice. She pulled up his medication sheet on the ancient computer that wheezed like an emphysema patient. Dr. Whitfield's post-op orders from 6 a.m. yesterday, midazolam for sedation, propofol for anxiolysis, morphine for pain. Standard protocol. Textbook. And completely wrong for a man whose trauma went deeper than muscle and bone. Paradoxical agitation. She'd seen it a dozen times. Sedatives that should have calmed him were winding him tighter, like someone turning a key in a lock that was already jammed. Combat-exposed nervous systems didn't always respond like civilian nervous systems. The brain that had learned to survive by staying vigilant would sometimes interpret sedation as a threat, the body being hijacked, control slipping away. She knew this. She'd lived this knowledge in her hands. It wasn't her place to suggest anything to Dr. Whitfield. That was rule number 1, the implicit understanding that had kept her employed and invisible for the past 18 months since she'd started working nights at Seattle General. Keep your head down. Do your charting. Don't challenge the hierarchy. Don't surface. But the Marine in room for 47 had eyes that tracked hers when she adjusted his for, and she recognized something in that look, the acknowledgement of one person who'd survived impossible things seeing another person who'd done the same. So she pulled Dr. Whitfield aside at 8:15 a.m., just after the morning shift arrived, in the hallway outside room for 45 where nobody was listening except the ghosts who lived in every hospital corridor. She kept her voice low, respectful, deferential in a way that felt like swallowing glass. Dr. Whitfield, I wanted to mention that Mr. Mercer's agitation pattern might be paradoxical. Combat-related trauma sometimes shows delayed response to sedation. Might consider adjusting the propofol, reducing the midazolam. He'd laughed. Not a small laugh. A real laugh, the kind that carried down the hallway and brought heads up from the nursing station 20 feet away. The residents clustered by the vending machines, 3 of them, interns who still believed the hierarchy was sacred, all turned to look. Did you get your medical degree from Wikipedia, Nurse Chen? Or did you just watch a YouTube video on tropical medicine? His voice had the texture of a tank idling in a garage, diesel, indifferent, heavy with the kind of confidence that came from never being questioned. He was already walking away, his white coat billowing like a cape he'd earned through 12 years of medical school and the kind of family connections that got you onto hospital boards. Stick to what you're trained for. That's the only protocol I need from night shift. The residents had smirked. One of them actually smiled, that ugly little smile that said they understood the hierarchy and their place in it. Sarah had nodded, stepped back, and returned to her rounds without a word. Her face remained flat. Her hands didn't shake. This was composure, not the absence of feeling, but the choice to feel nothing where anyone could see it. But a security guard had lingered after that, the one named Henderson who worked the ICU corridor most nights. He'd materialized at the medication station where Sarah was restocking 4 lines, and he'd mentioned something about Dr. Whitfield being concerned about staff who didn't understand boundaries, staff who thought they were doctors when they were nurses, and how sometimes those conversations needed to get documented. It wasn't a threat exactly. It was the architecture of a threat, the blueprint laid out in cautious language. She'd nodded at Henderson. Said something neutral. Continued working. The supply closet was her private place, the one spot in Seattle General where nobody looked for her. It was 3 meters by 2.5, lined with suture kits and trauma dressings and the kind of equipment that lived in the margins of hospital life. At 9:43 a.m., after the morning rounds when the ICU corridor finally quieted, she'd pushed into that closet and closed the door behind her. The fluorescent light flickered once, then steadied. She leaned against the shelf and reached into her scrub pocket. The challenge coin was tarnished silver, maybe 2 inches across, hammered from aircraft wreckage and shrapnel that had come from a Black Hawk that went down outside Bagram in 2011. On one side was an eagle with its wings spread. On the other side, coordinates 34 degrees 48 minutes 16 seconds north, 69 degrees 14 minutes 32 seconds east. The location. The operation. The thing that had been buried so deep that official records said it had never happened at all. Master Chief Petty Officer Sarah Chen didn't exist anymore. Not in any database the Pentagon would acknowledge. Not in any personnel file. Not in any way that would allow her to be seen. The confidentiality order had been explicit when they'd extracted her from Kabul and brought her stateside in 2012, surface, and the operation stays classified. The 16 Marines who died because decisions were made above her pay grade stay dead in a file marked secret / no phone. The operation stays buried. And Sarah stays invisible. So she folded hospital gowns at 3 in the morning. She charted medications for surgeons who dismissed her. She recognized the combat scars on men nobody else noticed. And she carried a tarnished coin in her scrub pocket like a piece of shrapnel she couldn't extract, burning against her ribs, reminding her every single shift that being seen was the most dangerous thing she could possibly do. She turned the coin over in her palm, feeling the weight of it, less than an ounce, dense as a star. Her thumb traced the coordinates. Bagram. The place where she'd ceased to exist. Where the person she'd been had been erased, methodically and completely, as if her 12 years as a Master Chief Petty Officer and lead combat medic had been nothing but a mistake in someone's filing system. The coin warmed in her hand. She slipped it back into her pocket and returned to the ICU, where Mr. Mercer was still agitating against his restraints, still sedated on protocols designed for people whose brains hadn't learned to survive by staying vigilant, still trapped in the kind of cage that nobody else seemed to notice was slowly killing him. Sarah had no idea what was about to walk through those doors. By Thursday morning, Dr. Whitfield's investigation had moved beyond whispers into something more deliberate. He sat in his office on the 4th floor, Sarah's nursing school transcript spread across mahogany that cost more than her monthly rent, his fingers drumming against the manila folders with the rhythm of a man who decided someone needed to be erased. The morning light cut through floor-to-ceiling windows that overlooked Philadelphia's skyline, and Whitfield's reflection in the glass showed a surgeon already composing the narrative in his head, the one where he was the reasonable man forced to act responsibly, and she was the credential fraud who'd somehow slipped through background checks like water through gauze. He'd called her listed references the night before. A nursing supervisor in Tacoma who said Sarah was competent but unremarkable. A charge nurse from a clinic in Portland who hesitated too long before saying anything at all. The hesitation was what Whitfield needed, that pause suggested something was being hidden, something was being carefully not said. He'd commissioned a formal background check through a private investigator he'd used before, a man who understood how to find gaps and how to interpret those gaps as evidence. The kind of man who knew that absence of records could be made to look like absence of legitimacy. Sarah moved through the ICU that Thursday with the same precision she always had, but something in the hospital's atmosphere had shifted. The other nurses avoided her in the break room. 2 residents who'd laughed at Whitfield's Wikipedia comment during grand rounds now looked away when she passed. She was being slowly, methodically isolated, and she recognized the pattern because she'd seen it deployed before, not in hospitals, but in forward operating bases where someone had been labeled a liability and the unit had begun the careful work of cutting them out of the team before the actual removal came down the line. She checked on Mercer in room for 47 just after 9:33 a.m., adjusting his foredrip, her hands moving through the motions with absolute calm while her mind stayed somewhere else entirely, somewhere with dust and rotor wash and decisions made in seconds that echoed for 12 years. By Friday afternoon, Whitfield's background check had returned with exactly what he needed. The gaps were there, significant gaps between 2012 and 2024. 12 years of employment history that couldn't be verified through conventional channels. He scheduled a meeting with the hospital administrator, a man named Bancroft who'd been appointed to his position by a board that Whitfield had cultivated carefully over 3 years of donations and the kind of professional courtesy that created debts without ever being explicit about them. In the administrator's office on the 2nd floor, Whitfield laid out the case with the measured precision of a surgeon presenting complications during morning rounds. The transcripts are from Washington State University School of Nursing, class of 2012, Whitfield said, his voice carrying the weight of reasonable concern. But there's a 12-year employment gap. Nothing. No verifiable positions. No references that can confirm continuous practice. When I called her listed supervisors, one of them couldn't even confirm she'd worked there. That doesn't happen with legitimate nurses, Mr. Bancroft. That happens with people who are fabricating credentials. Bancroft leaned back in his chair, his face arranged in the expression of a man who'd been expecting this conversation. You're saying she's fraudulent? I'm saying the evidence suggests credential fabrication, Whitfield replied carefully, each word calibrated for plausible deniability. Whether intentional or the result of incomplete documentation, we have a patient safety liability. She's been practicing on a license that may not be legitimate. She's been making clinical recommendations that contradict physician orders. And now we have evidence that her background cannot be verified through any standard channel. As the attending of record, I have a duty to report this to the credentialing committee. Sarah didn't know any of this yet. She was in room for 47 at 2:13 a.m. Saturday morning, the skeletal night shift crew reduced to 3 nurses for the entire ICU. Mercer's sedation had been adjusted twice in the last 4 hours, and she documented her concerns in the chart, careful, precise entries that couldn't be disputed because they were factually accurate and clinically sound. The monitor showed a patient whose body was still trapped in the hypervigilance of someone who'd survived ambush, whose brain had been taught to interpret safety as a threat, whose autonomic nervous system had never fully believed the war was over. She was adjusting his for when the monitor began its acceleration, slow at first, then faster, the beeping that started as rhythm becoming something else entirely, something that meant the sedation protocols were pushing a trauma-compromised nervous system toward something catastrophic. The flat line cut through the silence like a siren. Sarah moved before anyone else could register what the monitor was saying. She was running toward room for 47 while the night resident was still processing the alarm, while the other 2 nurses were getting out of their chairs, while Whitfield, who'd been sleeping in the call room for a scheduled morning procedure, was still fumbling for his phone. By the time Whitfield arrived, bare-chested under his unbuttoned shirt, Sarah had already called the crash cart and was preparing the intubation equipment with movements that looked like choreography, like she'd done this dance 10,000 times because she had. Whitfield took the lead, positioning himself at the head of the bed, his hands moving through the steps of the emergency procedure. But his movements were hesitant in ways they shouldn't have been. He fumbled the laryngoscope. Missed the vocal cords on the first attempt. The second attempt took longer than it should have. By the time he got the endotracheal tube in place, Sarah could see the problem. The tube was positioned too deep, the right mainstem, a rookie error that would collapse the left lung if nobody corrected it. She said nothing. Whitfield was the attending. The hierarchy was absolute. But her hands were already reaching for the tube position, her body already moving to verify placement on the monitor, her eyes already tracking oxygen saturation climbing on the screen, 62, 68, 71. "We need to pull back the tube," she said quietly. Not a suggestion. A statement. Whitfield's hands were on the tube, pulling it back 1 centimeter, then another. O2 sat climbed further, 79, 84, 88. Sinus rhythm returned to the monitor in the measured beats of a heart remembering how to live. The room exhaled. Whitfield stepped back, his face a carefully maintained blankness that suggested he'd intended exactly that maneuver all along. It was the transport medic who saw her clearly, who recognized something in the way her hands had moved with the confidence of someone who'd done this in desert heat with mortar rounds landing close enough to shake the tent. His name was Marcus Webb, and he'd been running supplies when the code came over the intercom, and he'd paused at the doorway watching a trauma case resolve with the kind of fluid efficiency that only came from having done it 100 times under conditions that didn't allow for hesitation. He'd seen her hands move, the way she positioned the 4-line with a single motion, the way she assessed the patient's response to stimuli with tactile information that most nurses had to learn from textbooks because they'd never had to diagnose compromise in 60-second windows before the evac helicopter landed. After the code was over, after Mercer's vitals had stabilized into the kind of rhythmic beeping that meant survival, Marcus cornered her in the supply corridor where she was restocking the crash cart with the same methodical focus she brought to everything. He was a big man, built like someone who'd carried wounded across hostile terrain, and his voice when he spoke was careful, barely above a whisper. "I know those hands," he said. "Bagram. Forward Surgical Team 8. You were there in 2016 when the compound got hit. You stayed until dawn. Kept working after everyone else was rotating out. The way you moved just now, that's muscle memory from somewhere that wasn't a civilian hospital." Sarah's hands didn't stop restocking. Her face didn't change. "I don't know what you're talking about." "Phantom," Marcus said, and he watched her shoulders go absolutely rigid. "That was your call sign. You were a master chief. You saved my buddy's leg when the orthopedic surgeon said it was a 50-50th call. I remember your hands on the surgical field. I remember you telling him he'd walk again even when we all knew the medevac might not make it in time." Sarah turned to look at him then, and her eyes held something that went beyond the careful blankness she showed everyone else. "You need to forget you ever saw that," she said quietly. "You need to forget you know that name. And you need to understand that if you tell anyone, you're putting both of us in a position that's going to hurt people we served with." Marcus nodded slowly. "But he's stable because of you." "He's stable because of a whole lot of people doing what they're trained to do," Sarah replied, returning to the crash cart. "Forget what you saw." But Marcus couldn't forget. And Sarah knew that already, could see it in the way his eyes held hers for one moment too long before he walked away. She'd just done something that violated every operational security protocol that had been drilled into her. She'd used skills in front of a witness that connected her directly to a classified operation. She'd moved like Master Chief Petty Officer Sarah Chen instead of like a night shift nurse named Sarah Chen, and somewhere in that moment, in that code blue where her hands had remembered operations her official records had erased, the timeline had shifted toward something inevitable. She finished restocking the crash cart at 2:38 a.m. Saturday morning, her hand steady, her breathing controlled, her face an expression of professional calm that revealed nothing at all. The monitor flatlined at 3:22 a.m. One long tone, the kind that strips sound down to something primal and final. Sarah heard it from 2 rooms down and moved before conscious thought could interfere. She was in room for 47 in 12 seconds, the cardiac monitor's rhythm already etched in her memory like a scar. Dr. Whitfield stood at the bedside with a crash cart 3 feet away and his hands frozen at his sides. The mute Marine, Mercer, 34 years old, 2 Purple Hearts, 1 son buried in Arlington soil, had flatlined during routine post-op monitoring. His chest rose and fell with the ventilator's mechanical rhythm, but his heart had simply stopped. "We need to move," Sarah said. Not a request. The words came out flat and authoritative in a voice that didn't belong to the night shift nurse who folded trauma gowns and deferred to surgeons. "Step back." Whitfield turned to her, his expression confused and slowing. "I have this situation under?" "Your hands haven't moved in 4 seconds. Step back." She was already unwrapping the sterile field. The 10-blade scalpel gleamed under the ICU lights like a fragment of something from another lifetime. Her fingers didn't tremble. Her breathing didn't accelerate. This was muscle memory wearing a nurse's uniform, waiting in the dark for 12 years to be useful again. Whitfield retreated. Sarah felt the weight of his confusion like pressure in the room, but she had already moved past it into something older and more certain. The fluorescent lights hummed their electric prayer overhead as she prepped the surgical field across Mercer's chest wall. "Someone call for a trauma surgeon." Her voice was the kind of calm that comes from having already survived the worst. "And I need a 14-gauge angiocath needle. Epi. Push dose. Now." A transport worker named Marcus Webb, the same medic who'd recognized her hands during the code blue 4 nights ago, stood at the entrance to room 447 holding a blood sample for the lab. His eyes widened. Not in surprise at the emergency. In recognition of something else. "Jesus Christ," he whispered, so quietly that only Sarah heard it. "I know those hands. You were at Bagram." She didn't acknowledge him. Couldn't. The left anterior chest wall beneath the 5th intercostal space was already prepped. The incision went through skin and muscle in one fluid motion, the scalpel moving with the terrifying precision of something that had been forged through 100 similar moments in a field surgical tent while mortars walked rounds across the compound outside. Blood welled up immediately. Sarah clamped the bleeding vessels with a presence that made the air in the room change. She'd done this when the ETA on medevac was 15 minutes and the patient would be dead in 8. She'd done this with incoming fire loud enough to rattle her ribs inside her chest. She'd done this when the difference between hesitation and certainty was measured in the seconds it took for a young Marine to bleed out. The ribs cracked open like a locked door finally surrendering to pressure. The pericardium was already exposed, and Sarah's gloved hand moved into the chest cavity with the kind of intimate knowledge that no night shift nurse should possess. Her fingers found the ventricles and began the direct cardiac massage, not CPR compressions, but internal work, hands cradling a heart the size of a closed fist and coaxing it back from the edge of nothing. Whitfield stood against the far wall, his face gone the color of old paper. O2 sat on the monitor, Sarah said, her voice like a command issued across a radio in the dark. "Now." 68%, a resident called out. The heart resisted. Then yielded. Sarah's hands worked with the certainty of someone who'd been trained for this by necessity rather than curriculum, whose training had come in a tent lit by Petromax lamps while the desert threw sand at the canvas. The massage continued, fluid and practiced. Each compression was information. Each resistance was data telling her what the tissue beneath her fingers needed. 72, the resident called. An ICU nurse had pushed the epinephrine. The seconds unwound like thread. 1 compression. 2. 3. The heart beneath Sarah's hands was beginning to remember its function. 79. Marcus Webb still stood in the doorway, his face registering something between recognition and the dawning horror of understanding. He knew what he was watching. He knew that Master Chief Petty Officer Sarah Chen was supposed to be dead, officially erased, classified into non-existence, removed from every record that mattered. She was supposed to be gone, folded into the same silence that had swallowed the 16 Marines who died in Bagram when the operation went sideways in ways that nobody at the Pentagon was prepared to explain. And yet here she was, hands deep in a patient's chest, pulling him back from nothing. 88, the resident whispered. The heart contracted under Sarah's palms. Not the mechanical response to medication. An actual, voluntary heartbeat. The muscle remembering what it was supposed to do. 92%. We have sinus rhythm. The resident's voice climbed. O2 climbing. Heart rate 96 and holding. We have him back. Sarah held her hand steady as the surgical attending arrived and took over the closure. She stepped back from the bedside with the same precision with which she'd stepped into it. Her movements were controlled. Economical. The movements of someone who'd learned decades ago that survival depended on never showing the cost of what you'd just done. But Marcus Webb had seen. Marcus Webb had spent 2 tours with the 75th Ranger Regiment at Bagram Airfield, and he'd seen hands like that before, hands that had held 9 young Marines together while the helicopters were still 30 minutes out, hands that had worked in a surgical shelter when the perimeter was collapsing, hands that had whispered to dying boys that they weren't alone, that someone was staying with them, that they didn't have to be afraid. Sarah walked to the medication cart to restock the epi-vials, and Marcus followed her into the medication room. He closed the door quietly behind them. "Phantom," he said. Very quietly. Just one word, but it was her call sign from a life that officially never existed. "Holy God, you're Phantom." Sarah's jaw tightened imperceptibly. Her hands continued restocking the crash cart with the same precision she'd used to perform surgery through a chest cavity. She didn't deny it. She didn't confirm it. She simply continued working as if Marcus Webb had said nothing at all, as if the word hadn't just fractured the sealed compartment where she'd locked away everything that came before Philadelphia. "You saved my squad leader," Marcus said. His voice was breaking. "You saved Tyler Patterson. You held him while we called for medevac, and you told him his daughter was waiting for him at Walter Reed. You stayed with him through the entire transport. And then 2 weeks later you were gone. Just erased. Nobody would talk about it. Command said the op was classified. Nobody talked about Phantom. I thought you were dead." Sarah placed the last vial into the cart. She straightened. She turned to face him. For the first time, Marcus Webb saw something flicker across her expression, not emotion exactly, but the surface tremor of something massive shifting beneath layers of control. "Tyler Patterson," she asked quietly. "Made it. Married his nurse from Walter Reed. They have 3 kids now. He still talks about you every time I see him." Marcus's eyes had gone wet. "He said you were the first person who made him believe he was going to live." The medication room was very quiet. The hospital's ventilation system hummed somewhere in the walls, and somewhere on the floor below, a code alarm was sounding for a different patient, a different emergency, a different life that didn't involve someone rising from the dead. Sarah turned back to the crash cart. Her hands moved with purpose, though there was nothing left to restock. She was buying time. Thinking through cascading consequences. Calculating what it meant that her hands had remembered how to open a chest the moment the flat line sounded, and that Marcus Webb had been standing 3 feet away when it happened. "You can't tell anyone," she said finally. Her voice was perfectly level. "The order came directly from above my pay grade. The operation was classified. 16 Marines died. 16. The decision to pull support came from people who will never face a court-martial, and I signed documents that promised I would disappear if I ever surfaced." "I'm not telling anyone," Marcus said quietly. "But somebody else is going to recognize you eventually. You don't move like a nurse, Phantom. You operate like a trauma surgeon who's seen more bloodshed than half the medical staff at this hospital combined. When that Whitfield guy showed up and started pushing you around, I recognized the setup. I've seen it before. Command burning someone to keep them quiet." He paused. His voice dropped even lower. "What I didn't expect was to watch you crack a man's chest open at 3:22 in the morning and pull him back from the dead using nothing but your hands and 12 years of training someone tried very hard to make you forget." Sarah didn't respond. She walked out of the medication room and back to Mercer's bedside, where the surgical attending was completing the closure and the Marine's heart was beating steadily on the monitor behind him. Steady. Strong. The kind of rhythm that meant he would live. The kind of outcome that meant Sarah had just made a choice, consciously or not, to use her hands in a way that would eventually be traced back to who she really was. In the corner of the room, Marcus Webb watched her, and in his eyes was the terrible understanding of someone who knew that secrecy, once broken, became something with momentum all its own, something that would keep moving forward until it destroyed everything in its path. By morning, the hospital administrator's office smelled like old coffee and institutional fear. Sarah sat across from a man whose name she'd never bothered to learn, her spine straight against the plastic chair, while Dr. Whitfield stood behind him like a shadow wearing a tie. The termination papers lay on the desk between them, already signed by people she'd never met. "Your personnel file has significant gaps," the administrator said, sliding a manila folder across the desk. His voice carried the rehearsed tone of someone reciting a script he'd been given. "Credential discrepancies. Employment records that don't align with your stated background." Sarah said nothing. Her hands rested flat on her thighs. Dr. Whitfield brought these inconsistencies to our attention during his routine background review. The administrator cleared his throat. "He contacted your listed references. 3 of them were disconnected numbers. Your nursing school transcript shows enrollment but no graduation records on file with the state board." Sarah's jaw tightened imperceptibly. The classified confidentiality order that had erased Master Chief Petty Officer Sarah Chen from federal existence 12 years ago had been explicit: surface your real identity, and the Bagram operation stayed buried along with the paperwork authorizing decisions made above her pay grade. The 16 Marines who died because of those decisions would remain classified. The operation would remain classified. Her entire previous life would remain classified, or the Pentagon would ensure it stayed that way. That was the bargain. That was always the bargain. "The hospital has a responsibility to our patients," the administrator continued, pushing the termination document closer to her. "We cannot employ nursing staff whose credentials cannot be fully verified. This is not a reflection on your performance, but rather a matter of institutional integrity." Whitfield smiled. It was the smile of a man who had spent the night on his phone making strategic calls, who had texted 3 board members screenshots of her employment gaps, who had commissioned a background investigation knowing it would find exactly what he wanted it to find: nothing. No military record. No service history. No evidence that she had ever existed as anything other than a nurse named Sarah Chen with suspicious gaps in her past. "I understand," Sarah said quietly. Her voice was steady as a surgeon's hand. No tremor. No protest. Just acceptance, which was perhaps the most devastating thing she could have offered him. The absence of resistance meant the absence of satisfaction. "You'll need to sign here and here." The administrator pointed with a ballpoint pen. "Your final paycheck will include 2 weeks of severance, per hospital policy. Your badge access will be revoked immediately. You have until end of shift to clear your locker." Sarah picked up the pen. It was plastic, the kind they ordered in bulk from discount office supply companies. She signed her name in the same steady handwriting she used for patient charts. Sarah Chen. Not Master Chief. Not the call sign that had meant something to 14 combat medics and 2 Navy SEAL teams. Just Sarah Chen, the nurse who'd overstepped her lane, the nurse who questioned protocol, the nurse who'd saved a Marine's life and thereby revealed surgical competence that didn't match her credentials. The signature took 3 seconds. When she finished, she set the pen down with the precision of someone placing a weapon in a safe. "You're permitted to finish your shift," the administrator said, which meant, "Get out. Now." Sarah stood. She didn't look at Whitfield. She didn't acknowledge the thin smile playing at the corners of his mouth. She simply stood and turned toward the door with the kind of composure that made the administrator uncomfortable enough to avoid her eyes. The hospital laundry was in the basement, past the loading dock where delivery trucks backed in with supplies that would keep Seattle General running long after Sarah Chen had stopped working there. The laundry attendant's name was Rosa. She'd been there for 9 years. She always saved Sarah the good pens and never asked questions about the occasional bloodstain that required special treatment. Sarah folded her scrubs with military corners. Navy blue fabric, still warm from the industrial dryers, collapsing into precise rectangles. The folds were muscle memory from a life that didn't exist in any official record. She stacked them in 3 neat piles and placed her hospital ID badge on top, the photo showing her half smiling, her hair pulled back, everything about her small and contained and unremarkable. Rosa looked away when Sarah set everything down on the counter. Not out of rudeness. Out of mercy. The kind of mercy that comes from understanding that some people are carrying more than laundry. "You're a good nurse," Rosa said quietly, still not making eye contact. "Better than good." Sarah didn't respond. She couldn't. The words would have cracked something she couldn't afford to crack, not yet, not until she was alone. The parking garage was empty at 3:22 p.m. on a Wednesday. Sarah sat in her car with both hands gripping the steering wheel, and for the first time since Whitfield had stood up during grand rounds and called her work cookbook nursing, her hands began to shake. Not visible tremors. Not the kind of shaking that would show. Just a deep vibration running through her palms and fingers, a physical manifestation of the fury and helplessness compressing itself into her bones. The challenge coin was still in her scrub pocket. She'd dumped the scrubs in the laundry, but she'd kept the coin. Her fingers found it in the cup holder where she'd placed it before walking into the hospital that morning, a tarnished piece of brass and silver, minted in 2012, stamped with the insignia of a unit that officially no longer employed her. She turned it over and over, the edges worn smooth from 12 years of touching it in supply closets and empty corridors, the only physical proof that she had ever been anyone other than Sarah Chen, night shift nurse. For a moment, just a moment, she considered throwing it out the window. Letting it bounce across the concrete floor of the parking garage and disappear. Letting Sarah Chen become complete. No anchor to the woman she'd been ordered to bury. No connection to the operation that had been classified and stayed classified while 16 Marines remained dead from decisions they never questioned because the chain of command said don't question. She opened her hand. The coin sat on her palm like her accusation. The thought came clearly, if she let this go, she let everything go. Not just a job. Not just a hospital. Not just the last thread connecting her to the person she'd been trained to be. And then she heard it. Faint at first. The sound of a helicopter's rotors cutting through the air somewhere north of the hospital. Not a medical transport. Not a news chopper. The sound of military-grade aircraft, the kind that didn't land at civilian hospitals unless someone had made a very specific call. The rotor sound grew louder, closer, until it shook the windows of the parking garage. Sarah's fingers closed around the challenge coin. She gripped it until the worn edges bit into her skin, and in that moment, in the sound of those rotors and the weight of that coin, she understood that what was about to happen had already begun. The classified operation that was supposed to stay buried had apparently decided to surface. Her hand stopped shaking. The convoy hit Philadelphia at dawn. 3 vehicles deep, armor gleaming, a Marine helicopter circling overhead like a predator that had finally caught the scent. The rotors made the windows of Seattle General rattle in their frames. A security guard at the front entrance watched the dust settle and reached for his radio, but the stone-faced colonel walking past him didn't wait for permission. He moved with the kind of authority that made protocols dissolve. His boots were polished to mirrors. His uniform carried the weight of decisions that had moved continents. "I'm looking for Phantom," he said. Not a question. The guard's hand froze on the radio. Sir, we don't have anyone by that." Master Chief Petty Officer Sarah Chen. Bagram callsign Phantom. She works nights. Nurse. I need her location in the next 60 seconds or this entire hospital becomes a federal crime scene. The guard's face went the color of old bone. 36 hours earlier, Sarah had folded her scrubs one final time in the hospital laundry. Now she was in her apartment in a civilian t-shirt and jeans, her challenge coin weighing in her pocket like a piece of evidence, when her phone rang with a number she thought had been deleted from existence. She didn't recognize the area code. She answered anyway. "Master Chief Chen, this is Colonel Graves, 75th Ranger Regiment. We have clearance from Joint Special Operations Command. A situation has escalated. I'm sending a vehicle. We'll be at your address in 6 minutes." The line went dead. Sarah looked at her hands. They weren't shaking. The vehicle arrived in 5. A Suburban with tinted windows and 2 MPs in combat uniforms who didn't speak during the drive. They took her to Seattle General through the service entrance, past the loading dock where suppliers wheeled in 4 fluids and oxygen tanks, through corridors she knew by heart but had never walked as anything other than a nurse. Now she was being escorted as something else entirely. The hospital boardroom was the same room where Dr. Whitfield had stood beside an HR administrator while Sarah signed her own termination papers. The same table. The same chairs. But now a 3-star general sat at the head of it, his dress blues pristine, his collar bearing the insignia of a man who commanded thousands. Beside him stood Colonel Graves, immaculate and still. Behind them, flanking the door, were 5 MPs in dress uniforms. Dr. Whitfield was already there. His face had the color of someone who had just realized the floor beneath him was glass. Sarah walked in wearing jeans and a gray sweater, hair in a ponytail, no makeup, no badge. She looked like a ghost haunting the room where they'd fired her. Master Chief Petty Officer Sarah Chen, the general said, his voice filling the space like water filling a vessel. Bagram Airfield, 2009 through 2012. 3 tours. 2 Bronze Stars. 1 Navy Cross. 16 field surgeries under direct fire. Emergency cricothyrotomy. Open cardiac massage through left anterior lateral thoracotomy. Open femoral artery clamping with a satin sky clamp. You maintained 94.3% survival rate in combat conditions where the median expectation was 67%. He paused. Sarah's jaw didn't move. The classified operation in Sanjin Valley, Helm and Province, 2011. You saved a Marine battalion. The official record states 8 friendlies lost. You kept it to 8 when the intelligence projection was 24. Another pause. This one longer. You were ordered to disappear after that operation. The Pentagon sealed your record. 16 years of your life erased from every public database. New identity. Civilian placement. You were told never to surface. Never to acknowledge who you were. That order came from my predecessor. It was wrong. I'm here to tell you it's been rescinded. Dr. Whitfield's hands trembled. He gripped the table edge and his knuckles went white. There's someone else here who wants to speak, the general said. The mute Marine from room 447 walked through the door. He was wearing a t-shirt and sweatpants, no hospital gown, and when he opened his mouth, his voice came out rough like gravel dragged across concrete, but it came out. She held my son while he bled out in Bagram when the medevac couldn't land. Stayed with him so he wouldn't die alone. Kept him talking. Kept him breathing. Then she saved 11 more before dawn. She's the reason I'm standing here. The reason I'm breathing. The room went dead silent. 10 full seconds. Nobody moved. The fluorescent lights hummed overhead and somewhere down a distant corridor a heart monitor beeped its steady rhythm. Then the general stood. He was a man built like a vault, shoulders that could carry armies, and he lowered himself onto one knee in front of Sarah Chen. He presented a formal commendation case, the medals catching the light, and when he looked up at her, his eyes held something like apology. Welcome back, Master Chief. The door at the rear of the boardroom opened. FBI agents in dark suits and blue windbreakers entered without ceremony. 2 of them moved directly to Dr. Whitfield while a third held a tablet showing forensic evidence. The screen showed Sarah's medical credentials, all of them, the real ones, the classified ones, the ones that proved she had been exactly what she claimed in every application she'd never actually made. Dr. Marcus Whitfield, an agent said, "We have a warrant for your arrest. Federal crime, forgery of medical records with intent to defraud. Attempted destruction of federal witness testimony. Conspiracy to obstruct a classified military investigation." Whitfield's face went the color of wet ash. He tried to stand and one of the agents applied gentle pressure to his shoulder. He sat back down. His mouth opened and closed like a fish pulled from water. "You can't, I was just." Securing your future, the agent said flatly. By destroying hers. The handcuffs clicked. Silver metal against the table surface, a sound like the closing of a door. Hospital security stood in the corridor, watching as Whitfield was led past them, his hands cuffed behind his back, his head down, the walk of a man watching his entire institutional structure collapse in real time. The nurses he'd dismissed with contempt stood at their stations. They didn't speak. They just watched him go. 6 months later, Sarah had returned to active duty consulting. 3 days a week at Joint Special Operations Command, coordinating trauma protocols with field medics in active theaters. The other 4 days, she kept her apartment in Philadelphia. Her bedroom faced east. She had a coffee maker that worked. She visited Seattle General's ICU on Thursdays. There was a plaque now, hung beside the staff entrance, in honor of Master Chief Petty Officer Sarah Chen, Combat Medic, Bagram Airfield 2009 to 2012. Service above self. Healing above ego. The plaque was stainless steel and would outlast everyone who read it. One Thursday in October, she was walking past a coffee shop near the hospital when she saw him through the window. Dr. Whitfield. Or whatever name he was using now. He sat at a folding table in a strip mall, a handwritten sign propped against a cardboard box, Insurance Solutions, Marcus Sterling. His name tag was misspelled. The letters were crooked. A woman approached him with questions about her policy and he flinched when she called him doctor, just the word alone made him recoil. His medical license was gone. His reputation was carbon. He'd pled guilty to 5 federal charges and served 14 months in a facility in Lewisburg before his release. Now he was 47 years old selling insurance policies from a folding table while people who'd once called him Dr. Whitfield walked past without recognizing him. Sarah watched him for exactly 10 seconds. His hands shook as he typed something into a laptop held together with electrical tape. His voice, when he spoke to the woman, was thin as a wire. She'd heard men like this before, men who'd lost the institutional armor they'd mistaken for strength. Without the title, without the hospital, without the network of favors and board connections, he was just a middle-aged man at a folding table trying to matter. She turned away and kept walking. Her shift started in 20 minutes. There were patients in the ICU who needed their vital signs checked, their 4 lines flushed, their monitors calibrated. There was a paramedic in the ER with a laceration that needed sutures. There was a combat veteran with PTSD finally taking the job offer that would put him on the hospital payroll. Sarah's phone buzzed. A text from Colonel Graves, Sanjin Valley veteran just arrived at Walter Reed with 3rd-degree burns. Asking for Phantom. You available? She typed back, wheels up in 4 hours. The truly brave ones don't seek recognition. They show up. They fold the scrubs. They check the monitors. They answer the phone at 2 in the morning when someone is bleeding out. They move through the world like people who've already survived the worst, so nothing that comes after can break them. The quietest person in the room might just be the one holding it all together. If you've ever worked alongside someone and later discovered they were capable of things you never imagined, hit subscribe and drop a comment. Who's the unassuming person in your life you think deserves more credit than they get?